If you get stabbing pains in your rectum or around your back passage, or when you open your bowels there's pain and discomfort, this video is for you. I'm going to teach you how to release the deeper layer of the pelvic floor, which surrounds your rectum or the opening of your anus, and it also attaches onto your tailbone. So if you get tailbone pain, if you get that sharp stabbing pain through your bum, then this is how you can release those muscles. So the internal pelvic floor is a layer of muscle that sits inside the pelvis and also on the outside of the pelvis. So it surrounds the entrance of your bum, but it then also helps to support the bowel, the bladder, and the uterus if you're a female, or your pelvic organs if you're a male. So all of these muscles are going to, if they're tight or if there's any sort of restriction through there, they can pull on the tailbone, causing pain, or they can surround and kink or tighten the rectum. And if those muscles go into spasm, it's like getting a cramp through your bum, like you would if you're getting a cramp in your calf or in your neck or wherever. You know, they're just skeletal muscle, so they're the same as your bicep, they're the same as your hamstring, which means a cramp in these can be incredibly painful. So how do we release them? So there's a couple of ways you can do it. Internally is going to be the most direct way. So this is a pelvic floor wand. This is our Bien pelvic floor wand. It's essentially got two ends. It's got an end that's a little bit more pointed and an end that's a little bit more rounded. If we're going vaginally, then I normally recommend starting with this flatter end. And essentially what you would do is enter the vaginal canal, and we would be aiming to get back towards these posterior or these back muscles that are attaching onto the tailbone and that are surrounding the rectum. If you wanted to do that rectally, so some people won't be able to reproduce their pain, or they won't be able to get the exact spot, and obviously if you're a male you only have one entry point, so then normally we would use this more pointed end and we would go into the back passage with a lot of lube, and we would then be able to have a little bit easier and deeper access to these back muscles. You particularly will need to do rectal release if it's this muscle, or if it's the muscle that's actually surrounding the rectum that's giving you the pain and discomfort. So this will then allow you to actually target those muscles specifically in your release. So let's talk through how exactly you're going to set that up. Okay, so you're going to prop yourself up on a bed with a bunch of pillows, or even against a wall can work really well. This is what your pelvis looks like, right? So the bony pelvis, this is the pelvic floor, and this is kind of like the outside of your pelvic floor. So we're going to need a lot of water-based lube, and we're going to put that all the way up to the neck of the wand, whether you're going vaginally or rectally. And we're aiming to get to these muscles that are at the back through here. So when we are using our wand, if I'm lying down like this, my pelvic floor is like that. So in order to get to those deeper muscles, the wand has to go in and then it has to go up in order for it to go down. So we're pulling the wand up towards our belly button in order to get to those deeper muscles. If you don't come up enough, then you are going to just be in dead space. So you're going to be just in the vaginal or the rectal canal, and you're not actually going to be reproducing the pain that could be coming from the muscles. So we need to make sure that that wand is pulled up towards your belly button. Before we go in the vagina or the anus, we want lots of lubrication up to the neck of the pelvic floor wand. And then particularly if you're a little bit nervous, or if there's any pain at the entrance of either of those muscle groups, then we're going to take a couple of breaths. So deep breath in, deep breath out. And on the inhale, really think about lengthening and relaxing the pelvic floor. So inhale and exhale. And once you feel adequately relaxed, we can then enter the vagina or the anus. You're going up to about the neck, and then, like I said, we're pulling up towards the belly button. So up like this, and you'll probably be holding it at the end like that, up towards the belly button, which will then get you on this deeper layer of the pelvic floor. So we would be going in and up so that we're on that deeper layer of muscle. So we're in this position, we find a tender spot, we take a deep breath in. Exhale, inhale, exhale. And you might just sit there taking some breaths until that pain or discomfort passes, or you might increase the pressure on the wand. So once it kind of subsides a little bit, you might then pull that wand even more up towards your belly button and take another couple of breaths and another couple of breaths until it surpasses, and then you would move on to a new spot. The aim is to kind of reproduce the pain that you're experiencing, or at least get close to it. So it might not be the exact pain, but if you're like, oh, that's the same area, or that feels like a similar sensation, then you bang on the money. The other way that you can then release it is by using a contract relax technique. So you would be inside the pelvic floor, we would then squeeze pelvic floor, release. Squeeze pelvic floor, release. And what this does is it gives a little bit more tension to the muscle. You keep constant pressure through the wand, and then as it relaxes down, that wand allows to get a little bit deeper into the muscle, encourage more blood flow, encourage more relaxation, encourage a lower tone through that pelvic floor. If you're doing internal release, you might spend, let's say, 10, 15 minutes on it, depending on your tolerance, depending on how long you've got. And then it's often best followed up either at the start or at the end with some mobility and some external release as well. So let's go through what that would look like. Okay, so you could use a ball or a tennis ball or anything that you've got lying around in your house that is just firm and that we can use externally. So this ball is going to be used on the big meaty part of your bum and on the spot just to the left or to the right of your tailbone. So we're trying to get to, on the outside, to this part of the pelvic floor. So I would normally set myself up on the floor. I'm just on the bed for ease. And then you're going to pop that ball just on the meaty part of your bum and then kind of transfer your weight so that you're sitting down on it. Take a few deep breaths in. Exhale. And if that's tolerable, then we would increase the stretch. Want to make it more intense, we would then come up into a glute stretch. So you would bend the opposite leg and then pop that leg, oh my gosh, that ankle rather, over the opposite knee, which is going to make it a lot more intense. If that's too much, you could extend this leg out and then come into a glute stretch like this. Again, a couple of deep breaths, play around with your knee coming in and coming out, and you're essentially just trying to find a tight, uncomfortable spot that feels a little bit good to release, but also maybe a little bit ouchy to release. That's how you know you're on a good spot. Then another way is, like I said, that spot as we're coming in towards your buttock line. So we're going to get right into that. And I like to just do this sitting and then with pelvic tilts. So you're kind of on this area on either side of the tailbone. And then I like to just come in and tilt my pelvis forward and then really curl it under and tilt it forward. And obviously you can then play around with like a little bit of movement, if a lot of pelvic tilt. If that's too much, then you can just do really small movements coming on and off it in order to get the right pressure through that muscle group. Take some deep breaths, inhale, relax pelvic floor, exhale, lift pelvic floor. So that's where I would start with external release and then followed by some mobility, which I will link here of different mobility exercises that you could do. We won't do them in this video. If you have any questions about any of that, if you want more information about how to use our wand or different ways that you can release the pelvic floor, please let us know in the comments below, or you can contact us on our website, bn.com.au. But otherwise, I hope this video was helpful and I will see you next time.